I also want to talk about care of your baby if they are circumcised. So there are different types of circumcisions, and depending on the type that they have done, that will determine the care that you need to do for them. So one of the common ones in this area is a placebel. So it is actually like a little ring that will go just around the tip of their penis, and that will just fall off on its own. So usually it will fall off about 10 days of life, and you don't need to do anything to it. It's recommended to not put Vaseline or anything on it like that. Same as the belly button cord, you do not want to submerge it in water until it has fallen off and it looks like it is healing. With that, I always like to warn parents, it does look gross. That's the only way to really say it looks gross. Whenever it is about to fall off, the skin around the outside will turn black, the string area that will turn black because that skin is just dying, and then the ring is gonna fall off. So sometimes before it falls off, there'll be a little piece of the ring that is kind of still attached. And so sometimes it looks weird because it's like sideways or crooked. That is okay. You just don't wanna mess with it. You wanna just try to let it fall off on its own to prevent any bleeding or anything like that. And so just let it kind of do its thing. And then once it falls off, you're done with it. And then at that point, once it looks like the area is healed, then you can go ahead and do regular VAS. If they have a circumcision done that's called a Gomco circumcision or a Mogan circumcision, those will basically just look like the foreskin is removed there. So it will just kind of look raw. That little part where the skin is removed just on the top of the penis will just look raw. And so with that one, it is actually recommended to do a little Vaseline to the area, and you just want to keep that on as much as you can all the time until it is healed. Usually by about a week of life, it is healed and it's looking a lot better. But it is normal when it's healing to have a little bit of like yellow tissue on the top. That doesn't mean infection. It's just kind of that normal healing tissue, kind of similar to the belly button when it's healing. What would be abnormal is if you were to notice increased swelling or redness, specifically more down, like lower down on the penis is usually where we would see that if it is going to happen. And so that would be something that you would want to watch for. The best way I think to do the Vaseline is actually if you can just get a tube of Vaseline. It's easier sometimes to just kind of squirt it, and you kind of just want to squirt it like an ice cream cone. You're wanting to cover that whole area that is raw because you want to prevent sticking to the diaper, because that's going to help it heal faster, and it's going to prevent it from bleeding.